with us in our last session of the webinar series, Includovate Thought Series. For those of you who don't know, this series seeks to listen through lively conversations to our staff about different issues related to inequality and injustices in our society to hear their different perspectives. Includovate is an organization, for those who don't know, that works on empowering women and seeks to work on including the excluded groups and answering their needs through inclusive solutions. Today, we will be speaking about gender equality and international development post-COVID-19. I am Rasha Amati, and I'm a senior researcher on gender studies at Includovate. I have here with me today an amazing panel today, which are Abiyot and Kia. I let you introduce yourselves briefly and say what you will speak about with us today, both of you. So I leave you the floor. Abiyot.
Yeah, thank you, Rasha, for inviting me. My name is Abiyot Nagara, and I am a senior researcher at Includovate. Today, I will be presenting on COVID and the women economic empowerment at this webinar. Thank you.
Thank you. And Kia, would you like to introduce yourself and what you would be speaking with us today?
Yeah, so my name is Iam and I'm a principal researcher on gender at Includovate, and we'll be talking about gender-based violence under the pandemic.
Okay, thank you very much. So to start, I will start explaining how the pandemic is affecting women and girls differently and vulnerable groups through our current situation. I will explain some of the factors that our pandemic is taking on the women and girls. So I will share my screen with all of you. Sorry. As I was saying, we will be speaking about gender equality and international development post-COVID-19. To start, I would like us to think about how this pandemic is affecting women. A lot of people have been thinking about if women will be again left behind and not prioritized, and the fact that this pandemic is a threat to a progress already achieved on gender equality. A lot of people are thinking that it's intensifying gender inequalities in societies where social norms already intensified inequalities before. Some of the gendered factors of the pandemic are the fact that women are more vulnerable to infections since they are the majority of the healthcare work systems. And also due to the social norms, they are usually the caregivers of the family in their community, which means they are at more risk of contracting the infection and getting sick. Also, women, they tend to carry burdens their burdens tend to grow during crises, which results on a toll on their well-being, mental health, and also their economic security. With the pandemic, we have all seen since March 2020, with all the measures of lockdown, different factors have promoted the surge and intensified violence against women and sexual assaults. Because a lot of women, they have been staying at home isolated with their abuser, which was a threat and danger to them. There has also been, due to the fact of the health system being in an emergency, there has been a disruption on health services that are basic for women and that they are unique to their needs. For example, to their sexual and reproductive health, and also pregnant women when they needed to access prenatal and postnatal care. The gender components of outbreaks and their response are frequently ignored until they become a problem. Also, some other factors that play a key role in the pandemic, it's gender, age, disability, ethnicity. All these factors means that these people, they will not be affected the same way as other groups in our society. Women also, they have been carrying an intensified burden and economic insecurity due to the fact that they lost their jobs and sources of income, and many women could not work from home remotely due to the type of jobs that they are doing. So this is why understanding the impacts of the pandemic through data is crucial. It would make us understand how to implement the recovery efforts and the response. Now I'm going to proceed with some key data for the audience to understand how there has been this pandemic is affecting women and girls differently. According to UN Women, in 2020, there has been a 25% worldwide of surge of domestic violence. Also, women, they make up 70% of the health workforce, and only 30% are leaders in the health sector. They are still not reflected in national and global decision-making on the response to COVID-19. And due to the fact and the economic shock that this pandemic is taking in our society, 58% of women, they are employed in the informal employment sector. In the countries where there is already conflicts and fragile states, women, they are still not represented in the peace mediation processes. Only 3% of women, they are mediators in these processes, and their needs, their unique needs, they are not implemented in these processes. And due to the pandemic and school closures, 89% of the world population of children and youth, they were out of school. Out of that 89%, 743 million, they were women. This means that the rates for youth unemployment rates increased intensively. And also we have to consider the fact that in middle and low developed countries, not everyone has access to internet and to be able to study from home. So there is a big gap and gender divide also in accessing these resources. And women migrants, they are also being affected and carrying an intensified burden from the crisis. There are 60 million migrant workers, and they tend to have an intent, they are losing their jobs, they are facing the lack of protection measures, they are also facing violations to their human rights due to the closure and restrictions of movement and the loss of income. And we are also seeing a surge of child marriages as families are trying to make a response to the economic burden on them. Regarding women's health, we have to consider that 40% of the world's population do not have hand washing facilities, which is a crucial measure to be safe from the virus. Not everyone has access to these resources, which means that displaced people and refugees, they are having a higher risk of having this virus. And also women, they are having difficulties managing their sexual and reproductive health and menstrual hygiene due to the fact that they don't have access to clean water and private toilets. Also, this pandemic is affecting differently rural and marginalized groups and people with low literacy communities. They are not having access to health quality services like before. And this access is already being heightened. This means that marginalized voices need to be included and heard in the response and recovery efforts more than before, because from before they already suffered pre-existing inequalities. Now I'm going to explain a little bit why data is necessary in the recovery efforts. Data is crucial to understand how different populations are experiencing the different impacts of the pandemic. Data that is blind to sex, age, and race and other factors will not help to implement an effective response. Gathering data in this pandemic is crucial to develop also implemented evidence-based policies, and it helps also governments to understand the extent of gender-based violence happening in their countries. This would help them in the recovery efforts and response, and to have also less violence happening. Also, governments need to allocate more resources and budget to disaggregate and collect data to be better prepared in the future. To finish, I would like to mention 3 key areas to keep in mind. Not all countries are now prepared as other countries. Low and middle countries, they're not prepared as developed countries. They don't have the same resources and capacity to respond to the pandemic. This means that even prepared countries, they are seeing that racial and ethnic inequalities, and they are affecting them to access basic healthcare services of quality. And in responding to the COVID crisis, it's essential to keep in mind that data blank spots may result from economic and social norms that keep women confined in their home and village. To finish, to establish an accurate picture of the outbreak and its effects, Cases will need to be disaggregated by sex, age, and location, alongside the data of social and economic gender inequalities and discrimination in our societies. Thank you. Now I would like to proceed with my colleagues to speak about how I would like to understand on a deeper level how domestic violence is affecting women through the pandemic. So I let you explain to us a little bit more, Kia, about this topic. Thank you. You're on mute. Can you please unmute yourself? Thank you.
Yeah, sorry.
No, it's fine.
Thank you, Macho, for a very detailed presentation on gender equality in post-COVID situation. And actually, it's what we're going to discuss upon today is more or less the same, but I would like to bring it down to the ground and see how it affects women and girls, particularly in relation to gender-based violence. So I'm going to share my screen. If possible. Okay. I'm not tech savvy, so sorry.
No, it's fine.
Yeah. Okay, for some reason it's not working. I can email the presentation to you and then you can share it on your screen. Maybe that's much better. In the meantime, I can just continue discussing on the need to discuss about gender-based violence and why I selected this issue to start with. So we have been hearing people saying that gender-based violence has increased during the pandemic, even more so than before. And statistics have come up supporting this. But at the same time, I have my own reservation on how we should go on into discussing about gender-based violence and also on bringing to attention the fact that the prevalence has actually been increased. Yep. So did you get my email, Raja?
Okay. I haven't received it.
Okay, maybe it's taking some time. So I just wanted to start with the saying that many have been labeling the gender-based violence as the shadow pandemic of COVID-19, and that it by itself is a pandemic that we have been living with for most of our lives. And UN Population Fund predicted that for every 3 months that governments enforce COVID-19 restrictions, particularly the stay-home policy, then an additional 50 million cases of domestic violence will occur worldwide, which is a significant number. And as I said earlier, there has been surging prevalence and reporting of gender-based violence. For instance, in the US, there has been reports that it has increased to 35% in terms of domestic violence. In Australia, the same increase has been seen, and the number they put it, some reports put it at 5%, others put it at 75%, which is a very significant number, even if the overall crime rates in the country has declined because of this stay-home policy. In China, there has been a threefold increase in gender-based violence. In the UK, an increase has been witnessed in terms of domestic homicide. In France, there has been an increase of 36 up to 36% in domestic abuse. In our continent, for instance, in Kenya, there has been reports that 40% of adolescent girls have faced domestic abuse and violence, whereas in South Africa, the same increase has been stated. So have you received it now?
Mm-hmm.
Okay, great. When we come to the country, our country, Ethiopia, yes. There are no accurate figures on gender-based violence, and that makes it problematic because when we talk about increase or surge in gender-based violence and have no figure to support this, people assume that others are politicizing it, or it's a recent trend of feminists or people who are advocating for gender equality where there is no need for it. But what the data that we are relying on, particularly for gender-based violence, is the 2016 the EDHS, which is the Demographic and Health Survey, which states that around 28% of all women face intimate partner violence, whereas 65% of girls have undergone through FGM, while 40% of girls under the survey have been married at an early age. So these are the indications or the parameters that we have, and it is a bit outdated to refer to, particularly when we are under a pandemic in 2021. So many of the data on GBV and the prevalence of it, particularly in this country, depends on anecdotal information or evidence, particularly that has been portrayed in the media. So, but since the first report has been the previous slide. So since the first report has been reported, which was March 2020, in May, the State Minister of Women, Children and Youth Affairs Bureau and the Prime Minister made a statement on violence against women and girls during the pandemic, and there should be no remorse to such situations and to the prevalence of it. In the Amhara Regional State, Women and Children's Affairs Bureau stated that 585 there were reported early marriage cases were existing in the region, and over 1,000 intercepted marriages in the region were reported. In Addis, meanwhile, between the months of April and May, over 101 cases have been reported, including sexual exploitation and abuse by close family members. We have heard a girl of age 12 being raped by her father, and similar cases have been reported here in Addis. And so the ministry also stated that 280 gender-based violence cases were reported between March 10 and May 29, but these numbers do not show the actual prevalence of GBV, given that most of the time these are cases which are underreported in the country and all over the world. So the next slide, sorry. Sorry for giving you another additional.
No, it's okay.
So my question here is that can we say that the prevalence of GBV have increased, because the numbers are really insignificant, 101 cases or 581 cases all over the country of girls facing or women facing GBV is very insignificant compared to the global statistics. So the problem is, first, there is no systematic recording of reported cases in the country, and also the figures that we find are reported by the media relying on data obtained mainly from cities, Addis and the Redowa, and also did not put into account girls or women of different background. And another problem that we have been facing in determining the prevalence of gender-based violence is the reporting system itself. So there is, as I've said earlier, underreporting of cases and misinformation circulated among government bureaus. So when I did research under the pandemic, we had this misfortune, I have to say, to get a report from Amhara Bureau saying that the Women and Children Affairs Bureau here in Addis reported the number of cases that they have submitted to the to the Federal Bureau. So there have been this kind of misinformation circulating within the government offices, which makes you doubt the numbers that we have been receiving in the media or by the government. And another problem is also the restrictions caused by the pandemic. To start with, there was a ban on transportation given under the state of emergency. And so people were not able to go to the closest Warada or Kabali structure and report such cases. And most of the government offices were not functioning at the time. So this puts restriction in the reporting system, particularly under the pandemic. The third one is politicization of gender-based violence, particularly here in our country. As I mentioned earlier, most of the discussions by the government offices or by most of what we call gender activists or organizations were very timely bound and pursuing their most of the time pursuing their own political interests. And for that reason, we have not been discussing about this issue, even if it was pertinent to gender equality and to the lives of women and girls in the country, since June or July. This motivated, I have to say, um, move toward this ending gender-based violence ended after 2 or 3 months of campaigns, basically. Next slide, sorry. So and when I said politicization of the pandemic, you can see on this screen of the trend that we have seen over the past 8 months. So when the government admitted that the prevalence of GBV is increasing, not only in number, but also in the severity of the type. There was a statement from the ministries and the Prime Minister's office. The public was outraged by this, and there was a public outcry, which led to the reopening of a Lenta hotline, but we have not received any data showing how many girls or women have used this hotline, given that there's a very limited access for women and girls over technology, and also over the information that this exists to start with. And also that also led to the opening of new emergency shelters here in Addis. But the problem is most of the time in other regions outside Addis. So opening of new emergency shelters was aimed to provide victims protection, given that their numbers have been increasing. But the fact that women were not able to access transportation to come to Addis was also a problem. And with that also, have the women and children benches in every court's function, and also the Attorney General promised to compile reliable data on GBV under the pandemic, but we haven't seen them functioning as well. And as I've said earlier, this was a kind of momentary movement to have different interests being achieved. And this all resulted also in a social media campaign, which was called Zimalalim, which literally means I won't be silenced. And this was started by artists and celebrities in the country, and more focused on children, because they were the ones who were mainly reported to be facing gender-based violence. And that is also a bit problematic, because our definition of gender-based violence in the country is very limited to early marriage and FGM, and it doesn't extend more toward, outward to other types of violences and abuses in the country. Next slide.
Yes.
Yep. So as I have said earlier, the lack of this integrated and intersectional approach in addressing gender-based violence is not only perpetuating the problem, but also it lacks evidence. And so people who are outside this group of people who are fighting against gender violence lack credibility, and also have unintended negative consequence of being objectified as a Western ideology of feminists, which does not exist in this country. Next slide. So in linking COVID and GBV, what needs to be done, in my opinion, is not limited to what you see on the screen, but at least it should accommodate all these issues. The first one is, as Racha said, economic insecurity and also other vulnerabilities, because women are vulnerable to gender-based violence as a result of economic insecurity and poverty-related issues. So most of the women and girls I have talked to under the pandemic were engaged in the informal sector, which was highly affected by the pandemic, and so we're out of work and we're out of income. So they have to look for some risky engagements. Some of them were begging on the streets and going back home late at night. And being on the street of Addis might seem safe to many, but under the pandemic it wasn't, because there were not so many people walking on the streets or outside. So these people did not have the the protection that they needed. And also other vulnerabilities such as disability were not being discussed. Girls with disability, women with disability have been the most victimized and the most at risk in terms of gender-based violence, because they don't report and they don't know the system, or they lack the awareness of it. And also the stigma related to disability makes it even worse. In addition to that, street children nowadays in great number are not only gender-based, but also age-based needs to be discussed and to be addressed. And next to that is the state of emergency and the invisibility of such kind of violence. Because of the stay-at-home policy, at least for Ethiopia, it lasted until September. During that time, being at home and being restricted at a limited space makes the violence or the abuse invisible, not only for the public in the community, but also for the government offices who are responsible to give protection to these girls and women. And that links to at that time. And even when they were opened, they were not functioning in full capacity. So they were very much limited to provide service and protection to these girls and women. And I can raise the issue of rape, for instance. I've talked to some girls who have faced such violence, and they were not able to access the hospital to get evidence to put the perpetrators in jail. And most of the time, particularly in the rural parts of Ethiopia, the hospitals where you can get such kind of evidence are far away from the local communities. And the fact that the transportation ban was there, and also after that was lifted, the expensiveness in transportation costs made it more or less inaccessible for these women. And also lastly, we have to put into consideration that this is homebound violence, and also the inability of women to escape. And the United Nations actually stated that the home or the house is the most dangerous place for a woman, but at the same time the safest, which makes it a bit problematic and contradictory, even for people who are trying to address gender-based violence. And the fact that it is homebound makes it difficult for women to escape such kind of violence. But at the same time, in contradiction to this, what I have observed is that most girls, for instance, adolescent girls, face gender-based violence when they commute to school, or when they commute to the market. And because of this restriction and the fact that they are staying at home makes them safe, but at the same time, they're not safe from their close relatives who are living with them. And that's what we have been witnessing in the past 8 months. So we need to accommodate all these factors when we are addressing gender-based violence, and when we are talking about the increase or the surge in the prevalence of it. Thank you.
Thank you very much, Kia. These are very interesting facts that you raised with us. It's very interesting to see what happened in Ethiopia. Thank you very much. I would like now to see, since we have seen how women, they are being vulnerable to this pandemic, I would like to see, Abiyat, your thoughts on their economic empowerment and why it's crucial to have them empowered through this process and crisis. Thank you. Can you hear us, Abiyat? Hello, Abiyat? Can you hear us? Yeah, you have to unmute yourself.
Okay, yes.
Okay, thank you.
Sorry. You hear me now?
Yes. Mm-hmm.
Yes, okay. Thank you very much. So I will be presenting on COVID-19 and women economic empowerment. So let me just say a couple of words on the impact of COVID on the global economy. As you know, the spread of COVID actually is not only a health crisis, it is also an economic crisis. So that is why we are talking about gender and this COVID and women economic empowerment. So it is really a tragic economic crisis for both men and the women, actually, but it differentially impacts women in a certain way that we are going to see. So the COVID-19, as you know, it led to the slowing down of economic growth or the GDP of the countries. The Asian Development Bank actually says that COVID cost the global economy between 5.8 and 8.8 trillion dollars, and this is a huge amount of money, and so we see that COVID really negatively impacted the global economy. Clearly, as you know, COVID also led to widespread unemployment in different countries, especially during the first phase when lockdown actually were declared in different countries. It led to unemployment. And as we know, then it mostly hit hard the labor intensive sectors where actually women also work much. You can see in the retail trade, the accommodation and the food and the beverage services, the entertainment and recreation services like tourism, hotels, whatever, and the garment industries where actually where women predominate. We see that these sectors actually were hit hard by the COVID crisis.
Thank you,
when we come to...
Sorry to interrupt you, Abiot. Just can you please go on full mode screen in your presentation?
Yeah, I'm coming to it. So in Ethiopia, it is predicted that COVID has negatively impacted the country's economy. The World Bank estimation provides that Ethiopia's growth will be lower by 4%. Like anywhere in the world, actually, it led to reduced employment. It also led to reduced household incomes. So my focus is on the differential impact of COVID on women. So even if women and men actually are impacted by the COVID pandemic, women in the economic sector are differentially impacted than men. On one reason, women actually are overrepresented in the informal sector, be it in Ethiopia or be it elsewhere in the world. Women actually are overly represented in the informal sector. The informal sector is less secure, and it really lacks legal protection, and it is less profitable. So during the lockdown, we know that the formal government workers were to some extent protected by the law, protected by their offices, and they were paid actually during that time. But those working in the informal sector, they were not secure. So women actually who were getting their income from this sector, therefore were hit hard because they are overly represented in the informal sector. The other is that the pandemic really hit hard the small and medium business that women actually engaged in. Women in the developing world are mostly engaged in small and medium businesses, and they were suffered. Of course, the women empowerment programs that we know in Ethiopia also focus on small and medium businesses as a way to empower women. Because of the COVID pandemic, these small and medium businesses also suffered. The other is the additional care burden. As COVID actually surged, people actually were staying in homes, and even with care when they are going out, women are exposed to additional care because children are still out of children were out of school, and women have to take care of them. So there was little time left for productive activities, and this actually impacted women economy and women empowerment. Across the world, of course, there is a gender pay gap. Mostly the surveys show that men are more paid than women. This means that women were exposed to the shock, the economic shock of COVID. The other economic aspect where women are differentially impacted is on the question of inheritance and property ownership. In cases where COVID led to deaths, actually women were not able to access other economic resources like land, and inheritance issues became an issue after the death, because social norms often restrict women, and then that actually has negatively impacted their economic empowerment. So the other thing is the digital divide, because of the pandemic, actually people resorted to the digital platforms for economic and other exchange, but women actually are less privileged in terms of access to the digital platforms. So cash transfers and other uses of the digital technology for women actually was restricted. This in different ways, therefore, impacted the empowerment of women. Even among the women facing intersecting forms of this marginalization, those living with disabilities, migrants, minorities actually were affected more than the others. We know around the world, xenophobia, stigmatizations associated with the different minorities. And therefore, even among women, if we put it under an intersectional lens, different types of women were actually differentially impacted. When we take the Ethiopian case, for example, female-headed households were affected more than the others. And we also know that job losses were higher for women than for men, about 6%. And those affected more in Ethiopia are also those who were self-employed and casual laborers in urban areas. So those who are engaged in the informal sector, like I said before, were the ones who were mostly affected in Ethiopia. So in conclusion, we can say that women economic empowerment efforts were suffered as a result of the COVID pandemic. And COVID had the impact of rolling back what has already been achieved. And then by hitting women businesses, the pandemic contributed to the perpetuation or exacerbation of existing gender-based inequalities that we have been witnessing. Thank you.
Thank you very much, Abiyot, both of you, Kia and Abiyot. Now I will start taking questions from the audience to both of you and all of us. So I have a question for you, Kia, from the audience. It says, why are feminists are bad in Ethiopia? And your role to ensure rights groups come up in large numbers to engage the government? If you'd like to answer. Can you unmute yourself, please?
Sorry. So yeah, the problem with feminists or the idea of feminism is because I don't want to say it's a recent thing, because we already have that thinking and ideology even in the old times here in our history. So but many believe that it's a Western ideology that we inherited, and that's leading to a path or a way which is very distant from our norms and culture, which many are trying to preserve. That's why when you say, I mean, in most, I think these days, I mean, it's getting better, but we are not at that level when someone comes out and say, I'm a feminist, and I'm proud to be one, because at some point you will be fought against at so many levels, and sometimes be labeled as supporter of LGBT, or they might categorize you in this group of people that undermines the very basic Ethiopian culture and the foundation of the country. Basically, that's why feminists are believed to be bad. I don't want to say that, but perceived negatively, at least in the country. But it is changing nowadays, though we are a long way to go. And Judith's question on the role of right groups in the country, we don't have that many, because there was a restriction on civil society organizations by the government by law not to engage in right issues until recently. If I'm not mistaken, Abiot, you can help me, until 2018 or 2017. And even so, we had local organizations which fought for the rights of women and children. But the problem is that when you do so, and when you try to bring the issue that you have to the government, you need evidence to support that. You need information, reliable information. And that's what we are lacking. As I was mentioning in the presentation, 580 cases of gender-based violence throughout the country in the past 3-4 months since the pandemic started is not enough number to alert the government to do something. Or 100 cases here in Addis, where there are more than 5 million residents, is not enough to make your point in front of government officials, who are most of the time, I'm sorry to say this openly and publicly, but are only for gender equality when their political interest is at stake. So you need more substantive information and data to support this, the campaigns or the cause that these groups are fighting for. But that's what we are lacking for most cases, and that's a problem. I hope I've answered your question, but if not, we can continue later on. Yeah.
Thank you very much, Kia. We have another question for you. It says, from Judith, it says, aren't there rights groups in Ethiopia to fight for the rights of women and children and freedom of information? As a researcher, what are you?
Personally, I would like to put myself as a researcher and not as a rights group or activist, because what I believe most is I want to provide, as I've said earlier, what they have been missing is the information in the data, and that's where I want to be at, providing that information that they seek most to prove what they are fighting against. Yes, there are rights groups in Ethiopia, but as I've said earlier, most of them were, most organizations, particularly foreign-based organizations, were closed down, not to work on the rights issues. So it was left more or less to the local institutions and local organizations. And I have to say, we don't have many working on women and children, and the few that we have are labeled as feminists and followers of Western ideology, as I've mentioned earlier, and so they're not given the right amount of attention that they need at the moment.
Okay, thank you very much, Kia. I have another question for you, Abiyat. Considering your amazing presentation about women's empowerment, how it's been hindered, what crucial steps do you think governments should take to address the gendered impacts of the pandemic to have an effective solution?
Okay, thank you. I think then, so we said women are disproportionately affected by the pandemic. And of course, then if they are really affected, what should we do actually to relieve that? One of the things has to do, I think, is that all the concerned body must, especially governments, must design economic recovery package for women. because the empowerment of women usually involves supporting the engagement of women in the economic sector. So many of their business are shattered. So as a way comeback, designing an economic recovery package for women would be important, I think. On the other hand, this empowerment, the empowering them actually needs resources. Therefore, besides designing the economic recovery package, I think the provision of financial services, this credit services for women-based businesses must be taken. And actually, in cases where the pandemic impact is severe, in the cases, for example, for rural women, maybe if there are more impacts in the rural areas, in some areas, I think digital extension services for rural women would help to provide them with information and empowering them through the provision of access to information, including maybe the provision of mobile phones, something like that. And overall, strengthening women institutions and trying to work through these institutions, I think should be taken as a crucial step to address the gender impacts of the pandemic on women economic empowerment. Thank you.
Thank you very much. And how do you think, any one of you can answer, either you or Kia, how do you think we can include vulnerable groups that both of you have mentioned they are being affected tremendously by the pandemic to have effective recovery efforts?
Kia, you can go first.
I think she
Yep. No, I'm still here.
Okay. Okay.
So if I'm not mistaken, the question is how to make vulnerable groups recover from the situation that they are in under the pandemic, right?
Yes, how to include them and have effective solutions.
Yes. The first thing is to recognize these groups as vulnerable and at risk. And as I've mentioned earlier, that's the problem, because we don't even consider them in the interventions or in the discussions or debates that we have under the pandemic or in general as being vulnerable. As I've said earlier, like the case with disability, we have not heard any justice or even the social media campaign or discussing about disabled girls and women being vulnerable to abuse and violence. And this is a global fact that has been supported by evidence all over the country, let alone Ethiopia. The same goes with other vulnerable groups that we have here in the country. So the first one is to recognize them and to put them in the debate that we have in the interventions or in the programs that we have. The other one is to make services accessible to these groups, because most of the services that are existent in the country are not open to women and girls, not just women and girls, but also men at risk, because we have been hearing sexual violence against men and boys as well. So it's not something that we should disregard. And they are actually more vulnerable than girls and women, because they cannot even come out and say that they have been abused or their rights have been violated, because it's a very social taboo for a man to come out and say he has been in such kind of a situation. So making services accessible and putting them into consideration in every intervention programs that we have is as a necessity and as a mandatory would be a step to take, at least for now.
Thank you very much, Kia.
Okay.
Would you like to go next?
Yeah, thank you. Kia has already raised, and let me add one point on hers. Yes, first we have to recognize them, that is right. By that, actually, then one step further, I think the governments are having different interventions to address this. And what I would like to say is there must be inclusion. There must be the implementation of inclusion sensitivity interventions. I mean, the interventions must be inclusion sensitive. I was recommending like economic recovery package, but when it comes to these marginalized groups, the interventions must be inclusion sensitive. That is one thing. And beyond recognition, it must be inclusion sensitive. The other point I would like to say is that this governments and other bodies must work with organizations and rights groups that actually stand for these vulnerable groups. Mostly when I was reading literature, the national committees for the recovery responses in different countries, they are not really involving these rights groups and organizations that stands for such kinds of people, because they have information, resources, and something like that. I think we should also involve these organizations and rights groups to effectively include the marginalized or the discriminated against. Thank you.
Thank you very much, both of you. Those are really good answers, and it makes us understand how to proceed. I have another question from an anonymous attendee. It says, women already work long days in Ethiopia, more than men. Shouldn't we be encouraging men to work more instead of women? Each one of you can answer. Whoever wants to
reply to this. I mean, to encourage men to work more means that we are admitting that they are not working enough. And I'm sorry, Aviot, for saying this. Here in this country, we believe that the men are the ones who provide for the household, so they work more than enough and toil more than enough, more than even other household members to provide for the family. But what we should, I mean, instead of telling men to work more, what we should do is to recognize the number of days and the amount of effort that women put into their work. And the fact that we have not been recognizing labor in the house that is spent on chores as work is a problem. So if we can convince people or the community that this is work that takes much of women's time and energy, then I believe the shared division of labor can be then attained than convincing men to work more. A bit.
Thank you. You raised an interesting point of domestic care being recognized. Thank you, both of you. Well, I have one last question and we will close the session since we are coming to an end. Any one of you can answer, whoever wants. How do you think, lastly, how can we engage more women to have power to participate in decision-making processes at all levels during the pandemic and leadership levels, since they are still not represented enough in these spheres? Any one of you would like to answer? Abiya?
Yes.
What do you think?
What was your question? Sorry.
How can we engage more women to have the power to participate in decision-making processes and leadership levels during the pandemic?
Yeah, thank you very much. Like I said before, for the especially the inclusion of the marginalized groups, one way to increase their participation is to involve women organizations, as I've already said. For the excluded groups, we have said that the right groups, the organizations that stands for them were not participating in the different national committees established for the COVID response. But when it comes to women, different countries actually are making the participation of women in the response effort. Women actually but made only about 24% of the national committees established for COVID response. That is what the literature says from what I've read. So increasing the participation or involvement of women-based organization would be one way of increasing their leadership and participatory role in the COVID response. The other thing maybe is to involve maybe the gender experts in the COVID response teams, and therefore they will be able to exercise leadership in the response effort. And I think these things should be prioritized. Thank you.
Thank you so much. One last question to take from the panelists I have. It's from Namatama. She says, I am aware that there are often restrictions on internet connectivity in Ethiopia. How do you think these women will be able to connect on the digital divide? Considering both of you are based in Ethiopia, what would you like to know?
So that is the most problematic thing that I was mentioning, access to information and to the internet, particularly be it here in Addis or in the rural areas. You've seen my connection going on and off even now while I'm here in Addis. So overall, I mean, it's really hard to say how women can be connected to the digital divide, because we have a long way to go for women to have access to technology in general to start with, let alone to the internet. Because when I was doing research for Gage for in more than 3 regions, most of the girls and women did not have even cell phone, let alone have internet access. For those who have one, they don't have the money to buy data or to go to this internet cafes, because it's a very it's a taboo for a girl or for a woman to go to the internet cafe and have access, unfortunately, to the internet. So I have to say we are a very long way, have a very long way to go to provide such kind of access to women. And just to add quickly on the question that you had before on how to bring women to political leadership, the first thing that we need to do is engage them in decisions at household level. Then that can be scaled up to political leadership or political involvement. And that needs to start with, starting from having the discussion of gender equality within the house, and the need to engage women in decision making to the benefit of not only women, but also to the men and also to the household. That makes it appealing for the man or for the community for women to engage in. And also there was a question that said, that was asking if there was a local version of feminism or a local movement of feminism, and there is. And as I've said earlier, in our earlier days in our history, we had women who can be labeled as feminists. And also we have local organizations here who consider themselves as a feminist organization, including Includovate. So we have them here in the country.
Thank you so much, Kia. I was very happy to hear both of you, your experience, your both expertise and thoughts, and have this conversation with both of you. We don't have any more questions from the panelists, so I believe our session ended. And I was very happy to have both of you today and have our last webinar of Includovate series. Thank you all the audience that participated and your questions. We are very happy to interact with you, and we hope we answered all your questions. Thank you. Thank you all for being here today. Thank you, Abiyat, and thank you, Kia.
Thank you. Bye-bye. Thank you very much.
Bye. Thank you.